So the first question is how to manage relapse of disease condition when the patient has shown initial improvement. So the good news is the patient has shown initial improvement. This is good. Now his problem is saying I was better for some time and again same symptoms are coming. What should we do? So this is a very important question, definitely. And what we need to do is basically to look at the case again. And the easiest way to look at the case is to start where the patient is at that current moment. So what's happening to you now? This is a very important question to ask. What is happening now? What is happening doesn't mean what are your complaints, what are your symptoms, what is your problem. This is not the question. The question is what is happening now, which means where is for you the energy in this moment. Patient can go to his complaint. He may say I am having a cough, but patient might also say I am very, very stressed or tense. The patient might say I had a dream last night. So whatever carries the energy in that moment is what is happening. And that's where you have to begin your process of inquiry. Whatever he comes to you with, whatever he puts on the table, you start with that. It might be a headache, it might be an anxiety, it might be a dream. Could be anything. He might also say your receptionist treated me very rudely and I am very upset about that. That's what is happening in the moment. So you don't need to apologize or call your receptionist and shout at her, but say, okay, what you experience in this moment. And from that, you will start to get individualizing symptoms. This word individualizing is very, very important. You have to keep on probing the case till you get the exact, very important word, exact characteristic, PQRS. So it is not enough to know that the patient has a bad cough and breathlessness. We know very well that the exciting factor, modalities, sensation, concomitants, these are definition of what makes a symptom characteristic. So you have to explore that. Or if he is angry, what is it in his experience or reaction up to that anger that is peculiar? For example, I had a patient who said, whenever I get angry and I can't express that anger, I feel a bitter taste in my mouth. My whole mouth becomes bitter. Very interesting. The remedy for that, I also don't know, so but in the repertory things are given, you see. So when you look at taste and then bitter, and then from there you look at vexation from, anger from, you get remedy petroleum. That was remedy that treated and cured this patient. So when I talk about eliciting individual symptoms or exact symptoms, it means you should never be vague or indefinite. Patient feels grief, patient feels anger, patient feels, this is not interesting. Patient is a very dependent person. This is not interesting for a homeopath. He is very insecure. What does it mean? We are not psychoanalysts. We are homeopath. Homeopath depends upon exactness of the individualizing symptom. It can be anything. You see, that's the interesting part. And that symptom can be also concomitant symptom. It may not be the chief complaint at all. Yesterday, I showed one case where the patient had a post-traumatic paralysis. His limbs were affected because of trauma. He had developed paralysis of his lower limbs. He could not walk. And there was nothing characteristic in that. Weakness of limbs, muscle power is less, unable to walk, post-trauma, nothing characteristic. Now, if there is nothing else, we will have to prescribe on that and find some remedy, maybe plumbum, maybe causticum, maybe anything. But big chances that it will not work because it is not individualizing. So, you have got to look for individualizing symptom. And in that case, I asked him, what else you have beside this? That is concomitant. So, concomitant symptom makes the thing peculiar or characteristic. So, that patient said, I have, every night at 4 o'clock, I wake up with eructations that are sour. खट्टे डेकार मुझे 4 बजे आते हैं. I said, 4 बजे? Yes, he said, almost by the clock I can tell you. 4 बजे, 4 o'clock I will get up and I will have sour eructations. Strange. So, then we use the reference works program and we put sour and 4 a.m. Anything sour happens at 4 a.m. doesn't matter what it is. And when I click that, I find one remedy only, that is tanacetum. And then you can look here that straight away it is given sour eructations 4 a.m. And then what is interesting also, here you have to use a little bit of your extra knowledge, that when you look in the relationship, you find that tanacetum belongs to compositive family. And what is compositive family? What do we know about it? Arnica, Calendula, Bellis perennis, compositive family. It's a trauma. So, post-traumatic very well fits into the idea of compositive family. So, he was given tanacetum 200 and he has improved significantly over the last 3 to 4 months. So, what does homeopathy demand is exactness, is peculiarity, is individuality. The more you get there, the better and more clear the results will be. I am not advocating that you have to prescribe on a single symptom, but I am advocating that in every case we need to be more exact. So, we look at the case again, start exploring what is individualizing, what is exact, what is peculiar, what is concomitant, what is the state of mind, what are the dreams, what are the stress factors, and how does the patient individually react to the stress factors. And what is peculiar about it? What is strange about it? In this way, we have to look at the case again, and then we have to elicit the totality in terms of either symptoms or system or genius. After this, we need to know that the remedy that is indicated is it the same remedy we gave, or is it a different remedy, or this we have to understand. If it happens to be the same remedy that's again coming, then we have to evaluate the level of the case. Is the patient still at the same level, or in our evaluation a higher or even a lower level? Higher level meaning, is he more in terms of sensation or delusion level, while you might have given him up 200 potency, he needs higher. Or he originally came with delusion, but now he only has physical symptoms, so he may need a lower potency. So if the remedy is exactly the same, you have to evaluate the level and change the potency. If the remedy is different, of course you have to change the remedy. Now what is interesting are 2 or 3 things. One is, very often the symptoms remain absolutely the same, but the state is different. That means the patient still has a migraine headache, what he came with, and maybe even the symptoms of the migraine are the same. But earlier his dream was a different one, today it is different. Earlier his craving was different, today it is different. His modality was something else and today it is something else. So even given the same complaint, the remedy might change. I had I don't know, memory is not so good, but just 2-3 days ago, I had a wonderful case that had responded beautifully to one remedy, and then after 6-8 months, that remedy is not doing anything. So the assistant doctor brought that case to me and says, "Sir, but this remedy is not responding. She was doing very well with it." Then I had to evaluate, and then I saw that the whole state had shifted. And so I said, that remedy just could not have worked. It's impossible. Very well I remember. It was yesterday only this follow-up came. I even remember the first remedy was Ignatia, and the second what we gave yesterday was Kalika. The whole emphasis had shifted somewhere else. So you have to, I tell you, as long as the remedy that you are giving does not cover the state of the person, it will not work, it will stop working. Even if it had worked beautifully for 5 years. The moment his state, his characteristics, his dreams, his delusions, his feelings, his particular peculiar symptoms have shifted, that remedy simply will not work. Because homeopathy does not treat the problem, it treats the state. If the state shifts, you have to shift. So in this way, we have to evaluate why this remedy has stopped working. Another possibility is that that remedy is a partially indicated remedy. And if that is true, then it is possible that the more accurately indicated remedy may be somewhere close to it. I remember one case of a colleague of mine called Praful Barwalia, and he was giving the patient, I believe he was giving ferrum metallicum, and then patient was improving partially, again little bit, again, but not good enough. And one day the patient gave him a dream, and he said, "I have a dream that my teeth are breaking or falling off." And when he saw this symptom, he found that there is no ferrum in it, but a very close remedy is there, Nicolum, because Nicolum is just 2 houses away from ferrum. Ferrum is in 8th column of the 4th row, Nicolum 10th column of the 4th row in periodic table, and this patient did beautifully on Nicolum. So in this way, when a new symptom come up, Again I tell you something. Even if the patient is improving with your remedy and has not stopped improving, if the current symptom, the most interesting, peculiar symptom and totality is indicating another remedy, for heaven's sake, change the remedy. Don't wait on the remedy that has helped. It's not going to help anymore. I know this from long experience. Only when it shifts back, again you can give the old, if it shifts back. So I do not stay. I remember one case that was about just few weeks ago. One pilot was there. This pilot landed up with a very acute slip disc and was in the bed and couldn't move, and it was very terrible pain and all that kind of stuff. So he came in very typical modalities of Rustox, and normally Rustox, if it gives you typical modalities in the slip disc, results are excellent. If it doesn't give you those modalities, your results will be bad. But normally you can assume that if you get typical modalities of Rustox, better by continued motion, better by heat, worse from rising from sitting, standing, Rustox will help beautifully. I gave him Rustox, much better. Then after a week, very fine, he came and I said, tell me, what is your symptom now? He's saying, I am feeling very much better. Okay, what about that stiffness that you had? Stiffness nearly gone. What about early morning? No problem. Now what is it? I still have some pain. Then what is your feeling here? Oh, I feel that there is a problem of time. You know, I have to report to my duty in 3 days. If it doesn't happen in 3 days, then my job, my career is in a problem. And I said, what is the problem then? He says, oh no doctor, I just enjoy flying like anything. I'm crazy about flying. What you are crazy about? Oh, you know that when I go up and then I have the control in my hand, and then there is this height is there, this control, and I am able to maneuver the plane through very difficult conditions sometimes. There is turbulence, you are afraid you will lose control, and then you keep that control on the plane and then you land it safely. That feeling of achievement, I like it too much. I said, tell me a little bit more about that. And then he says, well, at times, I don't remember the context, I get very anxious. And what is the feeling in the anxiety? He said, I feel suffocated, as if I cannot breathe. I feel I'm out of breath, as if I have to draw in the oxygen. So, what to do here? The Rustox had helped him. I was tempted to continue, but there was nothing to indicate Rustox at that moment. Neither was the severity nor the modality, and Rustox very acute. It's a typhoid miasm, we call it, very critical situation. But now what do we see? You see, one symptom is anxiety when the time is set. This is the first symptom. And there you see the main remedy, argentum nitricum. And what is the theme of argentum nitricum? One theme is control. So fear, and under that the rubric, self-control of losing. And then you see here argentum nitricum. And what is the other theme of argentum nitricum? Is the fear of narrow places. That means the feeling as if I am suffocated, I can't get out, I have to breathe. Claustrophobia. And what is the theme of argentum in our system? The theme of argentum is, when you see here, it is performance. I am a performer, skilled performer, and I have to maintain my position. And the miasm for argentum nitricum is cancer miasm, whose main word is control. So you have a miasm, you have a symptom, you have a system, everything coming together. So I changed the remedy even though patient was better to argentum nitricum, because I believe that at that point Rustox wouldn't help. Now the interesting part was that after argentum nitricum, the patient again needed the Rustox, because again once the modalities came, his pain became very severe. Again he was helped with Rustox. So in this case, we had to see what is the current state and treat it. If the state is argentum, you have to give argentum. If it changes to Rustox, you have to be alert and watchful. What is the state at that moment as indicated by the presenting complaint, the modalities, the mind state, the dreams, etc., etc. That's it. In homeopathy, that's the main art. Watch the state. How to manage acute condition during treatment of chronic case? Again, the answer is the same. You have to put your attention on what is the state at the moment. If the state is the same state as the chronic remedy, you simply need to repeat the chronic remedy. If the symptoms and the characteristics and the mind state of the current acute condition is different, then you have to change the remedy. For example, if a case of like child needing calcarea carbonica, last time we talked about it, isn't it? Lands up in acute fright and starts screaming, ah! This is not calcarea carbonica. Calcarea carbonica has no shrieking, no clinging, no frightened and trembling, no acute fear. It has chronic fear, want protection. This is not want protection. This is something is getting you at that moment. You have to run, get out of there. That is stramonium. So the current symptoms, the state is calling for stramonium. Calcarea carb not going to help. You have to give the acute. Maybe he need calcarea carb after that, maybe not. Again, you have to watch. But recently, our Dr. Shiti is here. We have a case, acute case in one woman is there, patient in Bangalore. Dengue she has got. Her whole family got it, she also got it. Fever since few days. Condition bad. But what is interesting is that during this fever also, when we ask her the symptom, she feels, I am closed, I want to be open, I want, everything seems very, very closed in, heavy, I feel very tight, I feel enclosed, I want to get out, I want open spaces, I feel very, very trapped in this, like this. Strange. This peculiarity completely matches with her chronic remedy, which is cannabis indica. That was her remedy that helped her in the past a lot. And what we found was that in the acute also, the same sensation, the same experience at the deepest level. So she is now receiving cannabis indica 10 and she is doing better. She is doing better now. No other remedy could have helped her. So one thing that I found, usually in children's cases, the remedy changes in acute 50% of the time. Whereas in adult cases, it changes only 10% of the time. But that doesn't say anything, because the case in front of you, whether it is in 50% or 10%, you don't know. So you have to look. Again, you know that handling an acute condition is a very important in terms of many things. First of all, diagnosis. I don't have to emphasize. Diagnosis is most important. Never treat a case without diagnosing. Never treat a case without examining. Never treat a case without investigating. And if you don't know what it is, refer the case to a medical doctor who is friendly to homeopathy and get the diagnosis. Otherwise, we are treating blindly and it's also medico-legally incorrect. So that you have to be very careful about that. So simply homeopath means symptom not good enough. And second case, in acute cases, very frequent follow-ups, maybe twice a day, maybe once a day. In my clinic and in academy, we have the kind of tradition of phoning the patient once or twice a day ourselves. We don't let them call, we phone. How is the person doing? So you have to be very, very watchful. And as symptoms change, many times in acute conditions, symptoms can change from one day to another. Remedy may need to be different even if patient is better. So every time you phone, you have to confirm that the characteristics still belong to the same remedy. Very, very important. Thirdly, another important thing about acute is that very often the patient who is not getting better with a chronic remedy during an acute presents the real picture, and that remedy may be actually curative in his chronic condition. So acute should be seen many times as an opportunity for finding the real remedy of the person. I remember one case very vivid in my memory. Was a small child about 2 to 3 years old who had come with atopic dermatitis. From head to foot he was covered with eruptions, and we were giving him sulfur and calcarea sulf and this and all kind of remedies. But one symptom was very interesting, that every time he would come to the clinic, that child, 3-year-old, he would say, patata vada khaun, or he would say, fish khaun. Every time he would talk of food only. Ye khaun, wo khaun means his repertoire was very big. And the mother said, he is such a, in Hindi you say khau, no? Means glutton. This thing I couldn't fully understand. The second thing was, he would talk very big about himself, and he would say, I am Rajinikanth, or I am this, and he would imitate, and then he would call his grandmother and he would tell her, you are my heroine. We will dance together, we will sing duet together, I will kiss you. All this kind of story was going on. Means he was making his own story there. But I couldn't understand all this very well. I thought this is egotism and this is desire for fried and whatever, and skin, therefore sulfur. I gave. Nothing happened with sulfur, calcarea, everything failure. About 4 months into the treatment, the mother called and she said, oh, very acute problem. What happened? She said, child collapsed. I said, what happened? Don't know. This my father shouted at him for some reason, and he said to him, your mother will never see you again because you behaved badly. That in a few minutes the child completely became collapsed, ekdam weak, cold, sweaty, and almost losing consciousness. Whoa! I said, what happened? Rush him to the hospital. They brought him to homeopathic hospital. I also rushed there. It was something like 11:30, 12 at night. I saw the child was cyanosed and sweating profusely, cold sweating, and not responding, not talking, just carried by the parent. I said, what to do? I said, I need an opinion. We need a pediatric opinion. Why the child has collapsed and he's cyanosed, blue? Something is grossly wrong. I don't understand it. I checked whatever I could, the heart and the pulse and this and that, but I couldn't make out. So a pediatrician, but in the meantime I thought, before pediatrician arrives, let me take some symptoms. And then I understood that the main story was of sudden collapse with cyanosis and coldness. And I found that, I don't remember all the symptoms, but I found the remedy Veratrum album. And you know this symptoms of Veratrum album, that it produces profound prostration, coldness, blueness, and collapse are characteristic. The effects are sudden and violent. It is a great fainting remedy, faints from emotions. This is exactly what had happened. Everything was cold, cold perspiration, cold as ice, breath cold, sudden sinking of strength. This was the story. Exact picture of Veratrum. From an emotion, total collapse, sweating, cold, cyanotic. So I gave Veratrum. The child, before pediatrician could even arrive, within 20 minutes, half an hour, child was recovered. And the pediatrician, what is the problem? What to explain? I said, now nothing, he is okay, go home. But what happened was that in the weeks that followed, the child's eczema started improving dramatically. And he was nearly without eczema for many years afterwards. Now, what is interesting, of course, in that story is that now when we look back, we see the rubric, this gourmand, that means wants all the delicious food, is a very important symptom of Veratrum. And so is egotism, and so is shamelessness, and so is all kinds of symptoms, this desire to dance or desires to kiss. Whatever he was saying was exact symptoms of Veratrum that I found out after the acute. And that's the reason why Veratrum helped this chronic case. So what to do in acute? I've told you several ideas that I worked out in practice. How do we make sure that patient is improving in all aspects during the follow-up? How do we know that it's not only his local symptoms, it's a deeper action? How do we know? For this we have a follow-up questionnaire form. So every patient who comes for follow-up has to fill out a questionnaire form. And there, the first question that is asked is, how are you as compared to the last time? Second question that is asked is, how is your local problems? Third, how is your emotions? Any stress factors or what effect it had on you? That means at an emotional level. What dreams did you get? That means delusional level. How is your energy level? That is at an energy level. How is your pathological reports? That means at a pathological level. So pathological level, local symptom level, emotional level, dream or delusional level, energy level, how is the patient? That is what we have to look at. And only when we see changes at all levels, we can be sure that the patient is healing deeply within. That means the nature of his sensitivity. Also what we do is, once in about 6 months in a chronic case, we evaluate the sensation. How do we do that? That means, suppose patient says that, I very much have this, let us imagine the patient is a magnesium carbonicum patient, and his main feeling is that I am completely dependent on somebody for care, nourishment, love, and without this person I feel like an orphan. I feel nobody cares for me, and I feel extremely scared that that person will die or leave me. This is his basic sensation, and then there are symptoms of magnesium carbonicum and dreams of mag-carb. First of all, we see his symptoms are better, his dreams are better, he is emotionally feeling better. But now how do we know his sensation is better? Because that is where really the disease is, at the experience level. So what we do once in 6 months is we explore the case again, and that's very easy to do. How to do? Take the first thing that comes. So, okay, so tell me, how is things going? Oh, last week we had a wedding in the family, and we had a lot of fun. It's good enough. Okay, tell me about the fun that you had. We all of us met and we had such a good time. Tell us about all of us met. So all of us met, we felt part of the whole thing, we felt like we are a family, we belong. I didn't feel any kind of loneliness. Tell me about the loneliness. Oh, sometimes I tend to feel that loneliness as if I don't have anyone, whatever it may be. Oh, so we are coming back to when you say nobody for me, what do you mean? Mean nobody to talk to communicate, nobody understands me, nobody knows me, this is all third row qualities and left side. So he is telling you magnesium again. At that point, we ask him, so this is your long standing feeling, isn't it? Your experience. He says, yes, yes. Now tell me please, how is the intensity of this experience compared to 6 months ago or compared to when you started with us? And the amount of change in that experience is exactly the amount of healing that has happened. If he says this experience is better by 50%, patient has healed by 50%. That's our measure. But we don't do this in every follow-up. It has to be done at long intervals. Otherwise, the patient will not notice from 1 week to another a change of experience. We normally do it once in 6 months. That is good enough to make out. In my experience, in 6 months, patient should notice a significant change in the sensation. The next question we ask is, what difference has this change made in your life? Means if this change is real, then his life situation, his relationship, his work situation, his interests and hobbies, his fears, his limitation must have changed. So he is able to talk with more people, he is able to communicate, he is able to feel more confident in situations, and that should show. If it doesn't show, we don't believe it. So we have to be most skeptical about the results. The patient saying, I am feeling better, not good enough at all. He has to define it, and he has to prove it that he is better. Sometimes in homeopathy it's the other way around. The doctor is trying to convince the patient. You are better, no? No, I am not sure. No, see, you used to have lot of headaches, now better, no? So you see a desperate attempt to convince the patient that he is better. Here we do exactly the opposite. The patient has to desperately convince us that he is better. He says, I am better. In what way? How can you say that? How do you know that? Then he has to tell you what he has observed. So unless you are that skeptical, you are going to realize at the end of 3 years that nothing changed. Are you with me? Sometimes patients who are not better say they are better, and patients who are vastly better say we are not better at all. So we don't trust either of them. They have to prove it. You are not better. In what way you are not better? Especially I found the Kali Carb, the remedy when I give, the patients always complaining and always say I am not better. So if typically patient will come, how are you? Not better at all, doctor. What do you mean? I am having this ache over here, Acha, what happened to your cancer? Oh, that cancer is cured, but what about my ache? I am just exaggerating, but this is how they are. So you have to be a little bit skeptical there also. Okay. Symptom method can be confirmed through repetition, whereas in system method there seem to be a lot of interpretation. How to avoid interpretation and arrive at indicated remedy? This is a very, very good question. Absolutely fantastic. This is the best question of the today. And the operational word here is interpretation. Now, interpretation is possible in symptoms also and in system also, and interpretation should be completely avoided. The patient says something, we can interpret into some symptom. For example, the patient says, I feel I didn't do the right thing. Okay, guilt. You have interpreted. Anxiety of conscience as if guilty of crime. Delusion, he has done wrong. Patient says, I feel, yaar, why all this is happening to me? Delusion, unfortunate. You can interpret symptoms also. Similarly, the patient says, I feel nobody cares for me. You put it, this is third row, this is second row, this is fifth row, this is animal, this is plant. Patient says, I am sensitive. You say plant. So interpretation is possible in either way. How to avoid interpretation? That is very important. To avoid interpretation, the opposite of interpretation is exactness. You have to avoid interpretation by exactness. Exactness means what? Exactly what the patient has said at a deeper level, exactly in black and white should be written somewhere. Then your interpretation is avoided. Whether it be symptom or it be system, you are not allowed to put one word into the mouth of the patient. And when you look at it like that, then the system method is also accurate and without interpretation. Why? Because you see, in every group, what is the system? That means we are dividing the remedies according to groups, and each group has a specific set of features. So when you talk, for example, I am just opening Vital Quest and reference information. So when you talk of, for example, row 3, so row 3 has a definite set of qualities: identity and nourishment, and then wanting to be different, ability to take decisions for oneself, developing a sense of right and wrong, developing the ability to express, forsake, doing things for oneself, care and nourishment, growth and development, and trust. These are the issues. And then there are fears, and then there are other things. You see, predictability, homesickness, attachment to specific things, appearance. How do I look to other people? Becoming self-conscious, isn't it? Embarrassment, another important. What happens at that third row level? That means he is a child. From infant, he is becoming his own person. What are the things that happen? Embarrassment, isn't it? Now he will not come and speak to the people. He will be shy. He will have to wear clothes. He will be not comfortable to be naked, isn't it? Then he will want good opinion. He will bring one drawing and say, look at this. Wow, so good. He likes it. Or the teacher will put a star. That means he very much depends upon the good feeling of other people in order to validate himself. Are you with me? So in this way, lost in direction, in this way you can see all this. So these are the issues. So what happens with these issues over there? The entire pattern of these issues need to be found exactly in the patient, in order that you say this belongs to this group or subgroup. That is the important thing. What people make a mistake, for example, forsaken, they'll say it is third row. Wrong. Along with forsaken, you must have problems of expressing right and wrong, decisions, how you look, care and nourishment. The whole pattern should be exactly found, exactly found. The patient, when he expresses at a sensation level. Now, not every patient expresses at sensation level. So you don't have to go to sensation and system at that point. Of course, with practice, more and more people you're able to get. But the important thing is, when you get that exact pattern, it must be as if the patient has read the book. As a word to word to word to word, he will tell you. Then you know that it's not interpretation. You follow me? Otherwise, it's interpretation. You take 1-2 words, you fill in the blanks yourself. Aise hi hoga, it must be like that. That is interpretation. But you must elicit, and you will see cases in your learning process or here where every single word of this book the patient will say almost exactly. Suppose it's a plant kingdom. Again, you can see here. And suppose, let us say, it is Anacardiaceae family, and you have the sensation. The patient will describe every word. That is why in a plant kingdom, I put here sensation, passive reaction, active reaction, and compensation. So it's not enough that the patient only gives the sensation. So caught, tight, stiff must be there, but also must move. Cannot move and must keep moving. This whole story must be available. If it is a particular miasm, every word of that miasm should be there. Suppose you have miasm words also. Go to miasms. Let us say cancer miasm. You can see the summary. Everything should be there. Chaos and control. Beyond your capacity. I can't do it. And when I don't do it, then it's finished. This should be there. Exactly. So exactness is the opposite of interpretation, and you have to develop this quality to be more and more exact. That is the art that you have to learn. That is the art you have to learn. I remember one case I treated in Germany, in Munich. It was a case of autoimmune vasculitis in a nurse. Patient was a woman about 30-40 years old, and she had developed, the whole limbs had developed like a gangrene kind of situation, and such severe pain, unbelievable. And she was taking the heaviest painkillers and whatnot, nothing was helping. Then she was brought in as a live case in one seminar. And I asked her, and it was an interesting story because there were 350 people in the seminar, and she sat in the podium right with me, in the stage, and there she was giving the history, and we were being translated, And I asked her, how come you are coming in front of all these people and giving the history? She says, because I am desperate. I have been everywhere, tried everything. You are the last hope. That is the first indicator of her state, that she is desperate. Things are completely out of control. So in this way, then I asked, so tell me a little bit about yourself. And she says, should I start from my childhood? I said, start wherever you want. And she said, I remember I was 3 years old. My father was drunk. My mother was drunk. Both were lying in their own bedroom, and there was no food in the house. And I was wondering, what can I do now? How can I get these people awake and get some food into their stomach and my stomach? I said, how did you experience that situation? She said, it was all chaos around me, and all I wanted to do was to bring some order again. Now imagine, at the age of 3 years, what can a child do when everything is chaotic? And the whole story unfolded. Everywhere she said chaos and control. And what was her job? She was a nurse in an acute psychiatric ward. And her job was to keep the whole thing in control. Can you imagine a more crazy place than that? Sometimes I think of the whole world as a psychiatric ward, but imagine a real one. That's where she put herself. So she got remedy carcinosin because the entire exactness, chaos, control, order, much beyond my capacity, the whole story is the exact pattern of cancer miasm. She did so beautifully on the remedy carcinosin. So there's no interpretation at all, it's exact from the mouth of the patient into the words of the book. We have time for one more question. How to retake a case by sensation method again after having taken once and failed in the first prescription? From where would we restart since the patient has narrated the presenting complaints already? That means the question, as I understand, the patient might get irritated. Arey, all this I already told you again, what you are asking? You are mad or I am mad? You know, this one joke is there. One English spy got into the army of Napoleon, French army, you know. So he didn't know any French. So he found out. He said through another fellow, says Napoleon comes and asks the soldiers 3 questions, always. Says, how old are you? How long you are in the army? Are you satisfied with your food and your lodging? And so he learnt the answers to these 3 questions. So how old are you? 22 years. How long in the army? 3 years. Are you satisfied with food and lodging? With both. Both. This is all he had to say. Unfortunately, Napoleon went and asked him, first question, how long you are in the army? So he said 22 years. See, he didn't understand the question, you see. Then he said, how old are you? He said 3 years. He said, are you mad or am I mad? So that's what the patient will say, are you mad or am I mad? When you ask the same questions again. But it's very easy to do that because in sensation method, you do not need to ask the patient his complaints all over again. You need to start with where the patient is. Most of the time, we don't even know what the complaints are till after the patient has come for a follow-up. Just joking, but it's like this. So the way of case taking of a sensation method can be very, very different from traditional case taking. So you are not going to go over the same ground again. Second thing is that even if you start with the complaint, what you are going to focus on is not only the modalities and the sensation, but the experience. And here is very important that you need to explain to the patient before you start, because they need to be prepared. And what do you have to tell them? You have to tell them, listen, we are going to try a new way of understanding you, of taking the case. In this method, we are going to focus upon not only your complaints, but your experience. How do you experience? In Hindi, अनुभव और एहसास, 2 words. आपका अनुभव क्या है? आपको ये एहसास कैसे होता है? इसके ऊपर हम ध्यान देने वाले हैं इस क्वेश्चनिंग में. In order to do that, to get to your experience, we will be asking you certain questions. Now it is possible that we may ask you the same question again and again. How do you feel? How do you feel? How do you feel? आपका क्या अनुभव है? क्या अनुभव है? क्या अनुभव है? We may ask you, or we may ask the same question in different ways. It doesn't mean that we don't understand what you say. It doesn't mean that you are not clear. It simply means that by asking the same question again and again, you are able to go deeper and deeper into your experience. First time you will say something, second time it will be little more detailed or deeper, third time even more deeper, and the deeper we get, the surer we are of what we need to do. So please have patience with us, bear with us, and just come with us in that process. If you give explanation in the beginning, you will face less problems. Of course, I never give this explanation because the patients who come to me already know this is going to happen. They have been referred by, you understand. In fact, my problem is that if I don't ask this, they get disappointed. Doctor ने ध्यान नहीं दिया, 15 मिनट में ही भगा दिया. अरे, he never asked me sensation. He never asked the gestures only. People complain. So we will focus on things and we will ask you, just be with them, be spontaneous. Just say whatever comes, don't think too much. And then together we'll find something. So in that way, the amount of confidence that you have and you demonstrate is what is going to take the patient with you. That's the most important thing. You have faith in what you are doing, explain to the patient and go in the process. Things will be very smooth and easy. In what way can we take a case by sensation method in day-to-day practice where time is short? Well, the answer is simple, that everything in the beginning will take time. Even a car driving is going to take you time. But once you know how to do something, it's going to be very, very quick. I am able to take cases within 10 minutes, sometimes in 5 minutes. I have demonstrated again and again in Gurukul once a month. I am able to take case within 10 minutes and come to the sensation. But ultimately, it has to be by practice. In the first instance, you will have to devote more time. As you practice, time will get less. And you can do it very quickly also. And there are other questions, but I think our time is up. Right now? So we will stop here.